very first in a conversation series that we're starting in the Employee Health and Wellness work stream, which is part of the Collaboration for Healthier Lives coalition of action at the CGF. And just to kind of set the context and the scene of where this all fits in, I'm just going to bring you through a 2-minute overview of what we're trying to achieve before I hand it over to the expert panel that we have today. So Collaboration for Healthier Lives, the mission, the overarching mission is empowering people to live healthier lives while creating shared value for businesses and communities. We obviously cannot do this alone, so it is a huge network of public, private, civil society organizations and members, retailers, manufacturers and their partners all around the globe working on healthier lives. We do this through three main areas. So inspiring healthier behaviors in stores and communities where all of you operate. We do this through digital ecosystems, an environment now where we're living our lives a lot more. And of course, the key area around our own workforces and what we can do to keep them healthy and energized. The framework that we use on Collaboration for Healthier Lives, you can see here, employee, stores in action and digital. We work quite strongly on commitments and accountability with our global stakeholders and through a number of key partnerships. So the Employee Health and Wellness team set about putting their priorities in a framework to put employees to the center and core of the agenda. So they work around 3 areas, and those 3 areas, the objective is really raising industry standards, developing KPIs and references when possible, and showcasing implementation and learnings. So health and safety first, in particular in times of COVID, we have been actively sharing how we can keep our people safe in multi-environments, stores, DCs, head offices, factories around the globe. And we will see how that evolves as time goes. There's conversations starting around vaccination and what's the role of our members in that space. So this is a moving space in times of COVID. The second area that we work on is our Workforce Nutrition Alliance. So how you can really use the workspace, the work environment to really drive nutrition in your own operations and across your supply chains. If you think of the scale of the impact, there's 10 million people working for CGF member companies and 90 million across the supply chain. So there's a huge opportunity through that alliance that we have co-founded with GAIN, the Global Alliance for Improved Nutrition. And the third area is where we are today. So the team came together and like many things, we often look for references, KPIs, benchmarks, and we found that in the space of well-being, it wasn't so obvious what that could look like. So we are in the development of a framework of action on well-being across organizations, what we can do in the space of access to programs and participation, what we can do in terms of culture, mindset shift, resilient workforces, and really ensuring that there is the opportunity to take part in these programs. And the third space, which we're still working on, is impact. How do we really understand if all of this is effective and having impact? And the team decided that they wanted to create a space for conversation. And you're at the very first of these sessions today, along with Danone and Grupo Bimbo. And today we decided to focus on employee health and leadership training, what we've learned over the last few months. So I hope you'll get some nuggets today that you can take back to your own company or share with your peers in your organization. But that's really the objective, is that we have an interactive session that you can ask as many. There's no good or bad questions, so please don't hesitate to use the Q&A or the chat box during the session. We've planned an hour for this, and you can see here the dates for the upcoming sessions in the series. So I'm thrilled to be with people that I have the pleasure of working closely with. So Joanna Androsio from Bimbo Canada and Grupo Bimbo, and Bruno from Danone are all working with the Consumer Goods Forum to really make sure we put employees first and foremost of everything we do, and who want to share how they, of course, well-being has always been part of the priorities, but what's happened in particular over the last year, and the importance of training for leaders to really drive well-being strategies across organizations. If you want to ask a question, just hit the Q&A button on your screen or send us an email during the session at HW at the Consumer Goods Forum. If we don't answer it during the session, I'll make sure that we follow up with you afterwards. So with that, I will hand you over to Rocio from Grupo Bimbo. So Rocio, over to you.
Okay, ready. Good morning, everyone. Well, I'm very glad to have the opportunity to share some time with you in this forum. Thank you, Sharon, for the invitation, and Joanne and Bruno for all the work together. Well, my name is Rocio Flores. I am the Global Wellness Manager at Grupo Bimbo. Before I start my presentation, I would like to share a little bit of our group. Well, we are a global company with presence in 33 countries with over 134,000 employees or associates, the way we refer to our employees. We started our journey to promote healthy lifestyles in a global perspective 5 years ago. Our two main objectives were and are build a culture that invites every associate to self-care practices and work every day to develop or adopt different tools to ensure a healthy environment in all our work centers. All this recognizing that workplace is a perfect environment to promote health. We are convinced on that. Our global wellness model promotes healthy lifestyles focusing in four main pillars: healthy diets, physical activity, occupational health, and life balance in all our organizations. In the past years, mental health has become a big challenge in our society and companies. We were not quite sensible on how work management have positive or negative impact on mental health of our associates, family, and communities. COVID-19 speed up all kinds of strategies regarding mental health at the workplace. I'm sure in all your organizations as well and as in Grupo Bimbo. We were able to offer in record time different kind of programs like psychological support lines to offer guidance and assist our associates and their families. We also are promoting different workshops regarding mental health. The thing about this is that the acceptance of our programs varied. In some of our locations, people were more motivated to use these kind of resources than in others. But why? Although we don't have the answer yet, we have evidence that countries where associates were already using these kind of programs increased acceptance during COVID-19. In locations where mental health support was quite new, it was the otherwise. We all know there are many taboos about health, and mental health is a big challenge. We know that when you are talking about changing culture, leadership is the key. If we as leaders are not aware of our own mental health and we don't have the tools to face arising problems, we are not understanding wellness at the workplace, and programs will not be successful, and therefore our leaders will think that all the investment is not worth it. It will make it difficult to receive future investments. As HR or wellness program managers, we need associates and leaders to get involved in wellness decisions. We also need strategic partners in and out the organizations. There are excellent health professionals and they can help us. I hope I was able to explain how important mental health is. Grupo Bimbo wants to share today a very good practice carried out by Bimbo Canada. It is focused exactly on mental health training for leaders. I'm going now to give the word to Joanna to share this experience. Thank you, Joanna, for sharing.
Thank you, Rocio. I'm going to share my screen in a second. All right. So as Rocio said, I work in Bimbo Canada. I'm the Benefits and Wellness Programs Manager here. And I want to tell you a little bit about our mental health strategy. So in 2013, the Mental Health Commission of Canada launched the National Standard of Canada for Psychological Health and Safety in the Workplace. It's often referred to as the standard. It was the first of its kind in the world. The standard is a voluntary set of guidelines, tools, and resources. It guides organizations in promoting mental health and preventing psychological harm at work. So Bimbo Canada is on a journey to implement this system as part of our multi-year strategy. Based on our research with colleagues in the industry and trying to manage the work needed, we decided to focus our efforts in creating a mental health strategy using 3 key focus areas: awareness, education, and destigmatizing mental health. So, as we didn't have any focus on mental health prior to this, we needed to make sure we had top-down commitment. We gathered disability stats, among others, to make a business case. Grupo Bimbo is very focused on the safety of our associates right around the globe. In Canada, we have incorporated mental health into our safety vision. We decided that we needed to educate people on how to improve their own mental health, but just as importantly, we need to educate people leaders to support their teams with their mental health. We recognize that mental health needs to be part of onboarding training, and even more important, as part of the return to work process after a leave that involved mental illness. We have had people quit the company after returning from a stress leave because of the way their manager treated them upon return. Under destigmatizing, we also recognize that it is important to normalize the conversation around mental health. There is still a taboo when it comes to talking about it. We play a video during our People Leader training where Howie Mandel, a North American comedian and celebrity, says that we wouldn't hesitate to tell anyone that we're popping out because we have a dentist appointment during the day. But you would be hard-pressed to find leaders who tell their team that they had to go to a psychologist appointment openly. Additionally, we do see the need to integrate this conversation around mental health as part of our diversity and inclusion initiative. It's hard to say that we are inclusive if we don't have any objectives to include people who may be mentally ill or even temporarily stressed, but have a lot to contribute. In 2020, we decided to focus on leadership training. We had started to plan this training in 2019, but in light of the pandemic, we decided to focus on this one thing because of the increased stress on our associates. We needed to provide top-down support for them so that they knew that their leaders are open and educated and able to help them through the crazy year that we've had, that was 2020. It also reinforced our safety efforts as we understood that mental health, whether created by an actual mental illness or just stress, is a key contributor to safe behaviors while at work in our plants and distribution centers. Considering we stayed open all through the year, this was important for us to continue feeding Canadians. We heard about the People Leader training offered by Morneau Shepell through our research with other organizations. We then worked with Morneau to customize this training for our company and to reduce the time of the training. We had to balance the need for this training with all of the other priorities bombarding our leaders. We then conducted focus groups to help us make improvements to this training, including a session with our entire HR team and our leadership team. From there, once we had finalized our training program, we were set to launch in-person training sessions when COVID-19 completely changed our plans. As such, we changed our approach and pivoted to virtual sessions so that we could continue to focus on this training in 2020. We were able to schedule and train many more leaders because we actually made it a virtual training. The curriculum of the training covers the following: understanding mental health and the associated stigma, the importance of knowing your associates' normal. This was an interesting concept that was new for us, where just being able to recognize if you have somebody on your team that every day says hello to you as they walk in before they go and start their day, and then they stop doing that's a break from their normal, right? And from there to number 3, It's also understanding the importance of digging deeper when either something like that happens or there's something that goes wrong with their performance. Don't just resort to a performance improvement plan, right? But actually try to dig a bit deeper. Then the training goes into how to actually have this delicate conversation with positive outcomes when you start to notice a change in behavior. We also touch on managing through absences and return to work, including a role play around that. And lastly, we talk about stress and how mental illness is not something you're just born with. You can get a mental illness through increased stress over time. So those are the objectives of the training. In the first few sessions that we held in 2020, we started having questions from our participants asking, do our leaders know about this training? Do they know about these expectations? And this is a valid question, as our culture has not yet normalized this conversation around mental health. So we decided to start each training session with a video of all of our management committee members discussing the need for this training and supporting it as a priority. We've gotten really great feedback on this video. As of the most recent tracking, we have now trained over 50% of our people leaders, and our goal is to finish training all of our people leaders by the end of this year. We will then make it a regular training for all new people leaders. We also want to reinforce this training with communication that helps people leaders remember the content and maybe perform an activity which reinforces the leadership behaviors taught in this course. Additionally, based on feedback we got from our operations team, we are making it a priority to create a 30-minute training video for our hourly associates to get some of this education. Lastly, one last initiative we want to talk about, we were able to launch this total health program for our associates to help them take care of their own physical and mental health. Because of COVID, we released this enhanced EAP program called Total Health. This program provides an integrated set of providers who work with each other to make referrals. That includes your traditional EAP employee assistance program, offering short-term counseling, a telemedicine offering for our associates and their dependents, an online pharmacy with home delivery, and a mental health platform which provides cheaper virtual long-term counseling options, which can be reimbursed through our benefit plans. The company made this investment understanding the needs of our associates to stay safe and yet to stay both physically and mentally healthy. And that's it for us.
Super. Thank you so much, Rocio and Joanna. So what we'll do is just keep thinking of your questions, and before we open it up, I'll hand us over to Bruno from Danone. So Bruno, over to you.
Good morning, good afternoon, good evening, everyone. I'm very glad to be with Bimbo on this first webinar series on leadership and well-being. So I'm the global head of safety, health and well-being at Danone. Danone is a multinational company, multinational food company with 100,000 people located everywhere in the world. And we actually started our well-being journey in 2016. And I'm going to share a few insights of what the COVID has brought to us. Can you confirm that you see well?
Yes, if you just put it on presentation mode and then we'll see full screen.
Okay.
Perfect. Thank you.
Actually, what is very striking is that, as I told you, Danone's well-being program started in 2016, strongly connected to our existing safety at work program, dealing with occupational safety, as we thought you cannot separate physical from mental, you cannot separate the head and the body. And instead of having two competing programs, it was better to enroll employees into an integrated prevention program. Unfortunately, the well-being part of this program was at a slow start until January 2020. And to be a little bit provocative, what COVID achieved in 4 months is what we couldn't do in a 4-year program, especially in terms of leadership awareness and leadership commitment on safety, on well-being, sorry, safety is there. And mainly because of the obstacles you see on this screen. Heavy denial, probably powered by the fact that we have a very strong hero culture in the company and everybody wants to commit to the results, everybody is very engaged. At the same time, well-being is something extremely new as a discipline. Probably we wouldn't have had this webinar series even 3 years ago. So there's huge ignorance. Many people think well-being is something personal and it's not the company business. And many of our leaders feel helpless about tackling the story. And you know, when you don't know a topic, you also fear it, because when you have no remedy, you tend to not to be willing to open the Pandora box. And also the business pressure, the need for transformation, the conflicting priorities, that also are obstacles for the senior management to commit to the topic in a consistent way, not only in the say, but also in the do. And clearly, over February, March, April, all those obstacles were overcome, and we had a very important commitment and awareness of the senior leadership about the need, not only to protect employees from COVID, but also to address the issue raised by employee well-being, especially the 50% of Danone employees that were obliged to telework, and most of them for the first time. Not in Europe, where home working is a regular practice for 1 or 2 days per week, clearly not for a full week, but for many other, it was new. On the other side, our plants continued to operate. And what was the extremely important, sorry, I stopped by mistake the presentation. What was very clear for the senior leadership needed to be explained, and it's clear that the COVID is actually impacting the 3 pillars of well-being at work. Well-being at work is a mix of balance between demands and resource. It's, by the way, the definition of the EU Agency for Safety and Health at Work, the unbalance between perceived demands and perceived resource from the employee standpoint, but also recognition and also the perspective of the employees and their future. And when we see what the well-being has been, the COVID has been triggering, is definitely an unbalanced use of the time of people, particularly because most of them were at home doing a family role, teacher role, and business role. A use of their skills that was hampered by the impossibility to discuss and to be present with colleagues, with customers, with suppliers. An impact on the role of the people, as many resources due to being locked down were removed from everyday activities. The difficulty to anticipate, and we currently experience it as the second of the third wave is looming ahead. We have always to change directions, and also the lack of support because colleagues, boss, are far from each other. In terms of recognition, everyone's work has been impacted. We have discussed with many professionals who felt their work was injured by the impossibility to visit their customers, to coach their plants, and to do their job properly. The sense of belonging has been hurt also by the distance, and also the meaning. After many weeks of confinement, many people were feeling, well, my job has no sense any longer because I don't see the impact. One important thing that stayed is N+1 direction, proximity management and feedback. And as Bimbo, you see that for us as well, it was a major investment. And second and third and not least, COVID has created a big uncertainty on the future. It has led trainings to be postponed before being moved to digital training. So personal development has been limited, including ability to travel, ability to go to seminars. Of course, many jobs, many hiring have been suspended, and in some cases, the reduction of activity has put some jobs at stake. Though we have not reduced any jobs yet. So the COVID has been the opportunity to explain to management and to share the understanding of what was going on. The management had the intuition that COVID was hampering well-being at work, and we didn't have to tell any longer, but we took the opportunity to share with management where the obstacles and the risk for the employees. At the same time, as I told you, Danone has developed a safety and well-being framework since many years. And this framework that you see has 3 time horizons. The first time horizon, called primary prevention, is you work to design organizations that are intrinsically healthy. So you design a collective mechanism, organizational well-being, so that actually your employees do not need to be protected because the organization is risk-free. The second level is more medium to short term. It's secondary prevention. You acknowledge that there are a lot of changes, there is a heavy workload, and you equip employees to cope with these risks. And it's very much about training, self-awareness, mindfulness, sport, good food, and so on. And the very short-term horizon is your people are already sick and you need to rescue them, okay, with specialized support. And clearly, with the COVID, we were strongly relying and focusing on tertiary and secondary prevention, because the COVID has briskly put us in stormy times. And when you are in stormy times, it's no longer the moment to build cathedrals. What you have not built as a healthy organization or as collective measures, it's very difficult to build them in urgency. This is why the COVID health and well-being actions have been more on the short to medium term. And why I share with you, is because leadership was very pushy to build cathedrals and to start to devise KPIs for the 5 next years and what will be Danone's strategy for well-being. And it was quite a lot of and very constructive meetings to explain that the urgency was to support the employees for the short term. Time will come to rebuild cathedrals, to build long-term strategy, and I'm glad to see that Bimbo could rely on a very strong existing strategy that they just had to ignite. We in Danone, our strategy had been, as I told you, as a slow start. So we focused on implementing or pushing to the max or existing short-term and medium-term prevention plans. Okay. At the same time, the COVID has also raised some unprecedented questions to company leadership on the question of what is our responsibility on employee health. Some of the key questions we have had to face is how do we balance the trade-off between home working, which protects people's health, physical health, and having them back to the workplace, which creates a risk on getting the COVID, but is not much better for their mental health. And this has been a permanent challenge that we have delegated locally and with no one-size-fits-all recipe. The second big question has been the digital dream. Can digital truly make up for all the COVID impacts? And because all our companies have digital strategies, there's been a big buzz on, yes, the digital will make up for all the COVID impacts. And actually, such a bold stance, first, is not true. And second, has in some cases added to the stress. Saying to the employees, continue to work as usual with new digital means is a risk not to acknowledge the big change on people's work and also the impact on truly human aspects of people's jobs and maintaining the illusion that people could still deliver as if there were no COVID. And I can give you an example in my field because I'm in charge of safety at work. It's not true that you can continue to audit your site safety as you would do with physical presence. There are things you can do, particularly on assessing standards, discipline, and compliance. But on safety culture, it's very difficult. And for the leadership, it has evolved in a more balanced position now, but at the beginning, such a position could create some ambiguity and misunderstanding and also some stress. The last big question is about how far can a corporation legitimately go to protect employee health. It has started with surgical masks, FFP2 masks, where our company started to buy them while the hospitals were already short of masks. It has continued with tests, and now we have the big issue with vaccine. And companies have tended to, by willing to protect the employees, to compete with governments and states, to compete for critical resources like masks, vaccines, and tests with other needs. And this has led leadership to ask ethical questions and companies to feel the need to reflect ethically on a very unusual manner, or a new manner at least. And the current situation with vaccine, do we have to force, for example, employees to get a vaccine, otherwise they cannot get to their job? So this really has raised the bar in terms of the nature of questions we have to ask ourselves in terms of employee health and well-being. Coming back to the basics, the first leadership responsibility is, and it's what we said to our senior leader, before thinking about vaccines, about testing, your first responsibility is to rescue, to monitor, and to equip on a day-to-day basis. This is why I share with you 3 tools, and some of them are common with Bimbo, making employee assistance programs absolutely systematic. And it was not the case at the beginning of the COVID. Only 60% of our employees could refer to an employee assistance program. Second, monitor employee morale, employee needs, employee situation in each and every of our subsidiaries. And you see some results about the perception of employees on being supported by their manager or being able to sustain the energy they needed throughout the work, or on the mental and physical demands on their jobs. And you see also in the bubbles the concerns of employees that we were qualitatively getting. And you see here, we had regular surveys, so every month to second month, you see employee concerns on workload, on work-life balance, on psychological and mental support, on work from home equipment, on recognition, on work prioritization. And the last of the third bits is awareness, communication, and training, with a very significant awareness and training program under the umbrella Stay Safe in 4 chapters: efficiency at work, physical health, proximity management, mental health, and solidarity of caring, because many of our employees have children or elderly parents or crippled neighbors or whomever they needed to support and to help. That's basically all about Danone. A last word, which is a very specific here, is that helping others into such a context need to start with each of us. And if you want to help your neighbor, help your employees, help your team, and for the HR people in particular, if you want to help the employees, health and well-being start with yourself. Otherwise, you risk ending up being sick or burned out yourself, as burnout is also an illness that touches very much those who take care of others. This is what I wanted to share with you. I think it will be time for questions, and I will stop sharing.
Super, thank you so much. And Bruno, I must ask my HR director, how is she doing? Because it's true, we don't often do that. And I need to stop asking the Employee Health and Wellbeing Group to build cathedrals. We have a tendency to do that at the CGF. But yeah, thank you so much, Rocio, Joanna, and Bruno for sharing that. So I've received 2 or 3 already by email, and I see that there's 3 questions popped up here. So let's just go in order of asking. So and this can be open to, you don't all have to answer, but open to all of you. So when a mental health issue is identified with an employee, who gets involved in the action plan? Is the manager, HR, an external consultant? So if you could give kind of an example from both your companies, who's actually involved?
I can go first if you want. So for us in Canada, we do rely on HR working with the manager to facilitate any kind of help. So if it's something where the person can continue to work, but they do require some additional, whether it's anger management or addiction counseling or something like that, we will rely on our EAP to do that. And our EAP provider has a referral service where they can provide feedback just to understand whether or not the person is getting the service that they need. If the person is not able to work, we would actually rely on our disability program to do that. So, whether it's a mental health issue or a physical health issue, if the person is not able to work, we go to our disability adjudicator and start an actual disability claim managed through our HR team. And that will determine what kind of help they need. So that'll become part of the disability case.
Yeah, go.
I will only, I will only want to add that that's why it's important when you are going to implement EAP program to first train all leaders and have this sensibilization of what to do, because it also can be dangerous if you don't manage the things right. So it has to be a clear strategy with clear stages, and everybody gets involved and know what to do in emerging. Because we also had some kind of emergencies, very so you have to be prepared for that, and you have the responsibility to train your organization for this.
Well, the question makes the assumption here that the issue is identified, and that's already a lot when the issue is identified. And let us re-emphasize the importance of collective vigilance and training all employees to detect, be caring, go and talk and say, you know, Rocio, maybe I'm wrong, but I feel you since 2 weeks, you know, you feel tired, anxious, you know, you don't come to have lunch with us any longer. Maybe I'm wrong, but you know, so that's the first thing, and also to train managers. Regarding the action plan, generally the action plan may be multidisciplinary. It may involve HR because there's an issue with the boss, maybe an issue with the job. It may involve a social assistance because there are some personal problems, debts, problems with children or whatsoever. It can also be start to be a medical problem because the person is no longer sleeping, is close to burnout. And this is why we have created in most of our companies now, since 5 years, a health prevention and monitoring committee, which is under the responsibility of the site leadership, the highest authority on the site, with occupational health, HR, safety, psychologists, and management, and a committee that is detecting the situation where the situation are referred to. They can be individual or collective in an absolutely confidential manner. And an action plan is decided and implemented by the different stakeholders of this committee. And wherever we have implemented it, we have clearly seen a move from very reactive cases. This person is about, or this team is just about to collapse, to more and more cases that arrive in the early phase where you can still intervene. And it's very interesting.
Right, thank you. Thank you for that. The second area is around the stigma around mental health. And for those of you who are interested, we do actually have on our website a mental health toolkit with different cases from around the globe. And stigma was a huge piece of that work. So the question is around, in some regions, it is difficult to speak about mental health. It can be really personal. Like you said, Bruno, kind of that, even having that way of asking or noticing if you're not normal anymore, like Joanna said. If that's perceived as an intrusion into your private, like how do you deal with that? And do you have any experience of regions where people are more comfortable speaking about mental health, or any regional examples that you could share with the group?
Definitely, mental health is strongly tied to culture. I think in China, if I remember well, the word stress does not exist. If I remember well, our employees in China describe stress as a lack of respect. Okay, so what you can do as a corporation is have a global program where the objectives and the tools are shared, but actually their detailed implementation, the vocabulary you use is definitely customized. And we know, for example, again in China, the power of small talk and not directly talk to a person with whom there is a big stake, and the big stake could be I'm really bad and my boss is seeing it. To have people in your environment, making sure you talk to the boss. And that's typically something that would be less the case in Netherlands, for example, where people talk to each other extremely directly. So definitely, there is no one-size-fits-all program and tools and trainings. There are global principles, there are global breaks, there are global meta tools and processes, but the details are local. Out of all the countries where we monitor well-being, there is only one country that is strongly protected against mental ill health, I see, is Indonesia. It's the only country where, because of their culture, with strong family ties and also their faith, it's true that our programs are less relevant.
Thank you. From the Bimbo side, you want to take that one, or we go to the next question?
I can't speak to the regional question. If anything, I'll leave that to Rocio. But as far as the question about, can it be too personal or intrusive when a manager is trying to ask about what's going on? That is actually something that we discussed in that leadership training course that hosted by Morneau. And if I could summarize that for you, it would be the important piece is letting your employee or associate know that you've noticed something, that you care, and giving them the opportunity to speak, but also respecting it if they don't want to speak. But once you do that, it's how can I help you? Here are resources available. Do you need me to do something different? When can we talk again? So there is a fine line between being intrusive and showing that you care. There's also a fine line between asking about what's going on versus diagnosing, and that's something that Morneau talks about quite firmly. But you do not want to go down that direction. So this program helps us with that in how to have that conversation, how to recognize how somebody's reacting to it, and how to just offer help. That's it.
I only want to add, for example, we as a global strategy, we always give line and give the opportunity to the different organizations to take a diagnosis, and they know what are their main risks and areas of opportunity so they can act. And regarding especially the question, as Joanna said, there are tools, and there are very simple tools. And that's why we need training, and we need to know how to do this, how to approach associates. And also something that we have looked is like, it's about culture. And I share with you, like for companies or organization where this was quite new, they were like, why they are asking me, or why they want me to call to some psychologist, and it's kind of scary. And it's very different in the other countries where we had these programs long time before. And yes, at the beginning nobody calls, but when they start looking that it's yes, we care. It's why we care, and company cares about you, and they start to notice that it's really confidential, and nothing is going to happen if you call and you have a problem. And also some colleague told you, oh, I call and it was very useful. So it's culture and it's time, and we have to be constant and patient. And so this is very important to be not put a program and then put it out and then again, because it lost credibility. We have to be very aware of what we want and be constant with that program.
Great, thank you. I see, Helen, you have your hand raised. Did you want to, we can unmute you, and if you want to ask your question.
Yeah, hi everyone. Hi, it's Helen from Aalderheid. Thanks for sharing, and I recognize a lot of what you're saying. My question is really, it also has to do a little bit with the stigma, because I recognize what you're saying, that some cultures are very, very open to seeking help and also receiving help. And in some cultures that we also operate in, it's like people would not want to open up to anyone, you know, that because they're afraid of their jobs or afraid of anything. But what I would also like to understand from your experience is, because especially with the COVID situation we had last year, you know, the pressure on the operation was huge. So we needed to keep people intact, and also the managers needed to keep their teams intact. So what I wanted to understand better is if you have situations where managers find it like more comfortable not to talk about opening up about mental health, or, you know, not to talk about it because it doesn't come in handy. You know, if people have certain things, how do you convince them, or how does the training maybe, you know, help you to convince them to open up and show care? And so, like, a little bit, what is the business case for the manager? That sounds a little bit impersonal, but do you understand what I'm saying?
Thanks, Helen. Yeah. Go ahead, Bruno.
There is a strong proximity, and it's probably why a reason why HR plays a very specific role here. Proximity management plays a key role. If we look at the levers of well-being, it's the proximity managers that plays a key role on the creating meaning, creating team spirit, belonging to the team, giving recognition, giving feedback. It's also the team manager who plays a role on balancing needs and demands and resource. So actually, well-being is a matter of well-managing. And by including well-being as part of the management and leadership development programs, and managing in health being something mandatory and why not evaluated, you will embark those who are late or do not believe in it, or yeah.
Great, thank you, Helen and Bruno. Joanna or Sue, do you want to add anything, or we move to the next question?
You are always going to find people react to that kind of things. And as we told also managers, sometimes we also need mental health support. And maybe you are in a rough time doing that, and you can recognize a problem if, for example, you had it, and for you are not going to recognize in someone else or in your team. So that's why it's cultural. It needs time. It needs to be consistent again with programs, and in one time that React managers are going to look at like, yes, I have to go there because everyone else is doing, and it's the culture of the company. So, but you are always going to find people who don't believe in that kind of things.
Great, thank you. Sorry, go ahead. Yeah.
I was just going to add to say, like, I really think the education helps with this. We review all of the feedback we get after each session, and people have written long notes on there about how they've terminated people that had they had this training before, they would have approached the situation differently. So, you know, being educated to be aware and understand how to have a conversation about it might make it more comfortable for them, even if they don't truly believe in it. That's I mean, I'm basing that on the feedback we received from our education. But Rocio is right that, you know, you can only do so much, and then it becomes a cultural shift that pushes people either away or draws them in, one of the two.